So the very first thing we're going to do is verify our order, and we have an order to insert a peripherally inserted venous catheter. We're going to review our plan of care. Make sure you identify what the IV is for. Is it for infusions, IV push, or just a saline lock? Look for any medical alerts of why the patient may not be able to have a stick in that particular arm. Some examples are a past mastectomy within the last 10 years, or a fistula, an AV fistula that they would use for dialysis. Gather all your equipment before going in your room. You are going to need a catheter. Make sure you know what gauge, and you would find that out by what's the purpose of it. If it's for IV contrast for a CT scan, or if it is for blood administration, we want to make sure that's at least a 20 gauge IV, or you make sure to get the gauge that is ordered by your physician. Also, I always like to bring 2 catheters because you may not be successful on the first stick and you want to have another IV catheter if needed in the room with you. Get a saline flush. Make sure to get an extension tubing. This extension tubing I will be using already has a cap attached. If it looks like this and it's actually open, make sure you get a CLC cap. CLC stands for central line catheter. Some facilities this does come separately. And then have an IV start kit. IV start kit usually comes with your tourniquet, your tegaderm, which is your dressing for your IV, an antiseptic or chlorhexidine, maybe an alcohol prep pad. Make sure your patient doesn't have any allergy to the cleansing agent, gauze, and tape. This particular one also has a strip to put your name and initials for after you finish your insertion. So we've gathered all of our equipment, we've checked our order. We're going to enter the room. Always identify yourself. Hi, I'll be your nurse today. Can you tell me your name and date of birth? As they say their name and date of birth, check their medical identification band and make sure that it is verified. I always say alert and oriented times 4. So always identify that your patient is alert to person, place, time, and situation. Explain why you're there and what you're going to do. The physician has ordered an IV catheter and I'm here to insert that. Do you know what that is? And then explain it in terms that they can understand. When doing any skill or assessment, we always perform hand hygiene, provide privacy for our patient. We will have waste for this procedure, so identify where your sharps container is in the room and also put a waste receptacle or a trash bin in an appropriate location that you can reach, and then place your patient in the appropriate position. I've already laid out our arm on this bedside table, but you may use wedges, pillows for your patient in the bed, and always put the bed up to working height for yourself. Put the protective towel or pad under the patient's arm. I've used a Chuck's pad here to protect the bedding underneath. And then we're going to assemble all of our equipment. On the bedside table, I have here my IV. I am using a 22 gauge, 1 inch. All the colors in facilities will be the same to match the gauge. You can see the color here. So I've got a 22 gauge here. I always loosen up my lid. So I have that. A saline lock. I'm going to prepare my equipment by priming this saline lock. Cleanse the tip here from the lure lock system. Once that has been cleansed, pull back on your flush to remove that air. It's a lure lock system, so push and twist, and then we're going to prime fluid all the way through. I always take the cap off to make it a little easier on myself, and I place it back into the sterile package. On your skills checkoff, it says maintain integrity. It's saying make sure that this is kept as clean as possible. You do not want to contaminate your sterile end after you flush that. And then I'm going to prepare my IV start kit. I take out my tourniquet. Our tourniquet, we're going to use a quick release system. So for my patient here, I'm going to place the tourniquet. Always pull. Be careful of their skin. You don't need it to be too tight. Quick release knot is just so you can pull this part right here and take that off if it was needed. I'm now going to check my radial pulse. The reason this step is included, you want it tight enough for a good venipuncture, about 4 inches above the site, but you do not want to cut off the arterial circulation. And then you are going to palpate your appropriate vein. For my patient here, I'm going to go in their AC area. I've palpated my particular area. And then once I have selected, I am going to go ahead and I'm going to release the tourniquet. It says don gloves, but I've already placed my gloves on after hand hygiene. And I'm going to prepare my site. So this kit includes chlorhexidine in a package. You may have chlorhexidine that you actually have to snap and break. And I'm going to start at my area, work outward. Once that has been cleansed, also something to keep in mind, any allergies to any cleansing agents, have that checked in your chart before you put anything to cleanse that area. So I'm going to wait for that to air dry. You don't want to fan that area, just let it air dry. Once it has dried, I'm going to reapply my tourniquet about 4 inches above the site in a quick release knot. So I've reapplied my tourniquet and I'm going to get my needle ready. So I'm going to take off my cap, always loosen it up. You're going to go bevel up at a 10 to 30 degree angle, and then you're going to advance the catheter into the vein. Once you obtain blood return or blood flashback, you can advance the catheter. Once you advance the catheter all the way to the skin where it is taut, you are going to stabilize, release your tourniquet, and then you're going to attach your saline lock and check for blood return. So let's practice that. So you are going to go in, hold it taut underneath. Don't go above because you can actually stick your finger here. So I'm going to go underneath, pull my skin taut, 10 to 30 degree angle. And I'm going to wait for my flashback here. And then I'm going to advance my catheter, just the catheter, while pulling out my needle. I've put it taut, and I'm going to pull my needle while holding and stabilizing, put a safety, and then I'm going to pop my tourniquet. You may have some blood dripping out, and that's okay. Just hold taut so you don't have blood coming. And then I'm going to hold while I twist. So as you twist this, hold stabilizing with both fingers. I've twisted that on, and now that I have stabilized, I'm holding here to stabilize my catheter. I pull back, I've got flash, then I'm going to flush. I want you to flush the arms with full 10 cc. So we're going to say I've already flushed my full 10 cc. There's a couple different ways to secure the IV now. I'm going to go ahead and use my Tegaderm. So I'm going to stabilize, pull the backing off, and then I want to make sure I do this at a window. This one has what they call pants, so you're going to put the clear window at the IV site. Yours will be completely transparent when you pull it out of the package, so it makes it a little easier. But I'm going to go ahead and secure at the insertion site, and then pull off my front of this dressing. This one comes with 2 pieces of tape. Yours will not. So if you want to pull 2 small pieces of tape to have, you can prepare that ahead of time, or you can do it after your IV has been secured like I did. That either way would be fine. Transparent film, which will be in your kit, so you can actually see the entire time where your insertion site is. Once I have verified flush, you should not have to force the flush. I'm going to disconnect my flush. This cap will stay. I'm going to lock my IV, and then I'm going to secure. I like to take a piece of tape underneath. I usually get a little bit longer piece, but this one will work. And I go up on both. And then I am going to secure this down just to make sure it's good and secure. And then you can take an additional piece of tape. Just to secure your saline lock. So now I have this clamp to where I can easily close and open it, and I also can have IV push medications or a port open for infusions. Next, you are going to make sure you take your extra piece of tape or the part of the tegaderm that it comes with. Make sure you initial, write the gauge, and then you are going to write the date that the IV was placed. You always make sure to double check that you have released a tourniquet. Your needle always goes in the sharps container. And then you are going to take all of your supplies, clean up your area, secure further as needed, and then you would perform hand hygiene and document your procedure. Some of your documentation needs to include the gauge of IV that you used, the location of where you have placed the IV, how the patient tolerated it, and you would want to